Hello, welcome back. I'm Nira Singh Shrestha, founder of Yoma, a knowledge hub for pregnant, new moms, and experienced moms. Thank you for joining us on our second live Insta Live session with Dr. Nira Singh Shrestha. So we were having a technical glitch. Let me see if I can add her again. Let me see. So in the meantime, I'm going to introduce Dr. Nira Singh Shrestha. Dr. Nira is head of Department of Obstetrics and Gynaecology at Mediciti Hospital. And she also has extensive experience in laparoscopy. And she's a laparoscopic surgeon who has received special training in advanced laparoscopy. So we've asked Dr. Nira to join us. She's having a technical glitch joining in. So we've received a lot of questions. Thank you for all the questions that you've sent. So we'll make sure all of those are addressed as well as the ones that are asked now. So we're still unable to get Dr. Nira to join. Sorry about this. We're still unable to see Dr. Nira. So Dr. Nira, you'll just have to accept the request that we've sent you. She's going this. Okay, there we have Dr. Nira. Hi, Dr. Nira. How are you?
Hi, Sneha. I'm good.
Yeah.
एकछिन टाइम लाग्यो टेक्नोलोजी यस्तै हो मेन टाइममा कहिलेकाहीँ गएर धोका दिन्छ सरी फर दैट
No worries. Yeah, welcome to हाम्रो Yomako second Insta Live session. And मैले भर्खर तपाईको quick introduction पनि गरे. And we received a lot of questions from हाम्रो followers, and I've grouped the questions into हाम्रो pregnancy related, postpartum related. So questions. We've a lot of questions, so I'll start right away.
Yeah, sure.
So few questions it's like related to during pregnancy. So the person who's asked is currently in her third trimester and she's having pain in her pubic area, especially when turning from side to side and getting up from bed. And she's asking, is it something to be concerned about? How can we ease the pain and how to reduce this pain?
So thank you for your question, Sneha. What happens is during pregnancy, त्यो प्रेग्नेन्सीको हर्मोनहरूले गर्दाखेरि हाम्रो बडीको धेरै जोइन्ट्सहरू लिगामेन्ट्सहरू अलि रिल्याक्स भइरहेको हुन्छ ओके अनि पेल्भिक एरियाहरूको जोइन्ट्सहरू पनि अझ बढी अफेक्टेड हुन्छ त्यसले गर्दाखेरि मुभ गर्दा पोजिसनहरू चेन्ज गर्दाखेरि त्यो दुख्नु भनेको टु सम एक्सटेन्ट हामीले त्यसलाई नर्मल नै मान्छौँ धेरै जसो अस्योरेन्स नै हामीले गर्छौँ हाम्रो प्रेग्नेन्ट मदर्सहरूलाई यु डोन्ट वरी अलिअलि हुन्छ नै Now, how you can ease all this pain, अलिअलि घटाउनको लागि के गर्न सकिन्छ भने one has to be very active, हैन एक्टिभ भयो अनि केही प्रेग्नेन्सी एक्सरसाइजेसहरू कोही फिजियोथेरापिस्टको हेल्पले अथवा योगा इन्स्ट्रक्टरहरूको हेल्पले एक्सरसाइजहरु सिकेर हामीले पर्टिकुलर एक्सरसाइजहरु गर्यौं भने पनि त्यसले एकदमै धेरै बेनिफिट्स चाहिँ हुन्छ बट कहिलेकाहीँ एकदम सिभियर पेन हुन थाल्छ एक्सरसाइजले पनि हेल्प गर्दैन त्यो कन्डिसनमा चाहिँ हामीले कहिलेकाहीँ रेस्टले पनि तपाईलाई हेल्प गर्न सक्छ टेक रेस्ट कुन चाहिँ पोजिसनमा तपाईलाई पेन हुन्छ अभोइड त्यो सकेसम्म अभोइड दैट पोजिसन पनि हामी भनेर भन्छौं अनि एट टाइम्स यु नो दोज पेल्भिक सपोर्टहरु आजकल यु गेट दोज सपोर्ट गर्ने बेल्ट्सहरु अनि एब्डोमेन बेली सपोर्ट गर्ने प्रेग्नेन्सीको सपोर्ट सिस्टमहरु पाइन्छ आजकल त्यो युज गर्दा पनि धेरै जसो पेनलाई रिलिफ चाहिँ हुन्छ यस
हजुर yeah I think it's quite I remember after pani during my pregnancy I did ask you I did have pelvic pain also with yeah I think it's quite I remember ani hunsa thank you for the answer Dr. Nira ani so moving on to the next so we actually got quite a few questions about leg cramps and calf muscle pain so someone who was in their 22 weeks pregnancy my leg cramps so is there a solution to it ani arko calf pain pani 31st week of pregnancy ma
yes
duita sangai
so arko common problem during pregnancy is calf muscles ko pain cramping hune rati sutnai garo bhayo भन्ने one of the very common problem madhema यो पनि पर्छ like अघिको joints pain भनेको जस्तो cramping is also quite common during pregnancy now त्यसलाई ठीक पार्नलाई के गर्न सकिन्छ भन्दाखेरिमा अब डुइङ अगेन यसमा पनि फिजिकल एक्टिभिटीको एकदमै ठूलो रोल छ जो एकदमै फिजिकली एक्टिभ छ जसले एक्सरसाइजहरु गरिरहनु भएको छ उहाँहरुलाई अलिकति कम एक्सपिरियन्स हुन्छ यो है र इभन लाइक एक्सरसाइज गर्दा गर्दै पनि क्राम्पिङहरु भयो भने व्हाट वी एडवाइज इज बिफोर गोइङ टु बेड डु सम लेग को स्ट्रेचिङ एक्सरसाइजहरु फ्यु मिनट्स को लागि लेग स्ट्रेचिङ एक्सरसाइजहरु हामीले गर्यौं भने त्यसले पनि धेरै बेनिफिट हुन्छ सुत्नु अगाडि ऑयल तेलहरु लगाएर मसाज गर्यौं भने पनि धेरै नै बेनिफिट्स हुन्छ त्यसमा चाहिँ हामीले पार्टनरको रोल पनि देख्छौं पार्टनरले अलि सुदिङ हैन फुट मसाज काफ मसल्सहरुको मसाज गर्दै भने पनि धेरै हदसम्म बेनिफिट चाहिँ हुन्छ एन्ड एट टाइम्स सम डायटरी रोल्स पनि छ त्यसको सो कसैलाई क्याल्सियम डेफिसिएन्सीहरु भइरहेको छ भने आफ्नो डाक्टर्सहरुसँग कन्सल्ट गरेर क्याल्सियमको डोज बढाउन सकिन्छ हैन आफ्नो खानामा म्याग्नेशियम रिच खानाहरु लाइक टेकिङ लट अफ नट्सहरु यस्तो खालको चीजहरु खायौं भने पनि त्यसले बेनिफिट चाहिँ गर्छ कहिलेकाहीँ चाहिँ एकदमै सिभियर इन स्पाइट अफ डुइङ एभ्रीथिङ कसैलाई काफ मसल्स पेन भइराख्यो भने हामीले कहिलेकाहीँ त्यसको लागि औषधिहरु पनि प्रिस्क्राइब गर्नुपर्ने हुन्छ बट दैट्स ओन्ली व्हेन थिंग्स आर भेरी सिरियस त्यस्तो बेलामा मात्रै नै हो यस नभए अघि मैले भने जस्तो सिम्पल होम रेमेडीजहरुले एक्सरसाइजहरु मसाज ले धेरै अनि अलिकति डायटरी इम्प्रुभमेन्ट्स ले धेरै जसो केसमा इट हेल्प्स yes
diet ma like a lot of people say bananas but it's rich in potassium
yes banana yes yeah true र कहिले के हामीले जीवन जलहरु टन्न खानुस् न टेक लट्स अफ लिक्विड्स जीवन जल किन त्यसमा टन्न इलेक्ट्रोलाइट्सहरु हुन्छ त्यसले बडीको इलेक्ट्रोलाइटलाई ब्यालेन्स गर्छ एन्ड दैट हेल्प्स सो मैले जीवन जल पनि धेरै नै खाऊ भन्ने गरेको छु यस्तो खालको कम्प्लेन हुनेहरुमा yes
thank you
yes
so I kind of questions related to it so I kind of lumped it together so a lot of questions related to food also so is it does certain food really lead to miscarriage like papaya pineapple timur mint or is it just a myth so there are lots of myths
so you sabanda commonly asked questions whenever a pregnant couple arrives I know number 1 ke khana hune ke khana nahune that's like the first question everybody asks I know अब खानासँग प्रेग्नेन्सीको रिलेटेड कतिको छ भन्दाखेरि धेरै जसो त मिथ्स नै छ है धेरै जसो र अलिअलि यो मिथ्स चाहिँ कहाँबाट आएको छ भने हाम्रो घरमा समाजमा हैन आदि कुरा हामीले बुझेको छौं आदि कुरा हामीले बुझ्दैनौं अनि त्यसमा थप्दै लगेको हो आफ्नो आइडियाजहरु फर एक्जाम्पल हाम्रो आयुर्वेदमा खानाको क्याटेगोरीहरु छ हैन कुनै कफ वात पित्त भन्ने आई एम नट लाइक भेरी गुड एट आयुर्वेदा बट स्टिल अलिअलि थाहा पाएको अनुसारले सो हाम्रो आयुर्वेदमा चाहिँ धेरै छ हाफ थाहा पाएर खानाहरुलाई हामीले कुनै कुनै खानालाई एकदम ब्याड फुड हो यु शुडन्ट बी ह्याभिङ व्हाइल यु आर प्रेग्नेन्ट भन्ने कन्सेप्ट्सहरु छ For example, तपाईले पनि अघि भन्नुभयो जस्तो papaya, pineapple, timur, mint, etc., isn't it? So what
Yeah.
happens is pineapple, papaya, यो सबै काँचो खाने हो भने, if you are having raw pineapple, raw papaya, then according to Ayurveda, it will cause contractions in your uterus, पाठेघरलाई contraction गराउने र कहिलेकाहीँ early pregnancy मा miscarriage गराउन सक्ने possibility छ according to Ayurveda. But if you are taking it raw, काँचो खायो भने, तर एकदम पाकेको fruits छ, healthy organic fruits छ, if it is papaya, pineapple, जुनसुकै fruit पनि एकदमै राम्रो पाकेको fruit हो भने, it will not cause any harm to pregnancy. Okay. Similarly, our mint-हरुको कुरा पनि त्यही छ. If you are taking like any herbs for that matter, if you are taking in small amount, herbs-हरु हामी सानो amount मै खान्छौं. So if you are taking in small amount as seasoning to your food, it will not cause any harm to you. Okay. So यिनीहरु myths नै हुन्. So anyway, avoid anything raw. Okay, uncooked खालको चीजहरु, and anything कुनै पनि doubt लागेको छ, कसैले भनेको सुनेको छ भने, avoid that in excess quantity. Take in small quantity, and then you'll not have any problems. Yes.
Yeah. And what about caffeine during pregnancy? This is, I mean,
another good धेरैले सोध्नु त हुन्न, but I myself advise limit your tea or coffee to like max 1 or 2 cup a day. Avoid गर्न सक्नुहुन्छ भने even better. खानै पर्छ भने 1-2 कप भन्दा बढी नलिनुस्. ग्रीन टी को कुरो पनि आउँछ यसमा. धेरैलाई हामीलाई कन्सेप्ट के छ भने ग्रीन टी त एकदम हेल्दी हो. ग्रीन टी मा क्याफेन अलि बढी हुन्छ. सो ग्रीन टी पनि अभोइड गरेको, खानै पर्यो भने एकदमै स्मल क्वान्टिटी. सो अभोइड गरेको नै बेटर हो, बिकज यसले चाहिँ बेबीको ग्रोथहरुमा चाहिँ पछि गएर अलिकति प्रब्लम गर्न सक्ने, ग्रोथ राम्रोसँग हुन नदिने त्यो पोसिबिलिटी चाहिँ हुन्छ. Yeah, so better to avoid.
Yeah, better to avoid खायो भने only 1 cup a day to limit.
Yeah,
it.
1 or 2. Yeah, max 2. सानो कपले, अब कपको साइज पनि varies. ठुलो कप हो भने फेरि maybe just 1. Yeah.
Okay. Okay. Yes. So thank you. Yeah, this is a very commonly asked questions. Everyone.
Yes.
So we also have a few specific questions. Someone wants to know more about pregnancy after removal of one ruptured tube due to ectopic pregnancy.
Okay, so possibility of pregnancy after one tube is removed due to ectopic pregnancy, isn't it? So normally important organs haru hamलाई भगवानले दुईटा दिनु भएको छ के. So similarly fallopian tube एकदमै important organ हो for any woman to conceive. त्यही भएर दुईटा दिएको छ, isn't it? So even one is removed should not be a problem in conceiving next pregnancy because one is good enough. Okay. However, एकचोटी ectopic pregnancy भइसकेको छ भने possibility of second pregnancy also having ectopic अलिकति बढ्छ in comparison to normal human being. त्यसले गर्दाखेरिमा one can plan pregnancy. धेरै जसो बेला pregnant भइ पनि रहनु भएको हुन्छ. However, pregnant हुने बित्तिकै एकचोटी आफ्नो concerned gynecologist or obstetrician सँग भेटेर thorough checkup चाहिँ गर्नुपर्ने हुन्छ. त्यो चाहिँ important छ. Yes.
Yeah. Thanks a lot. Yeah. Okay. I'll move on to I'll move on to the next question. This is also related to pregnancy. You know, these certain complications that could possibly come. So this is about fibroid, how fibroid affects pregnancy, and how long should you wait after having fibroid surgery in order to, if someone is planning to conceive.
All right. So very good question, because nowadays fibroid is also very common in किनकि हाम्रो women they are planning their pregnancy a little later. So fibroids एकदम common encounter हुन्छ आजकल during pregnancy. So if fibroid is small, then त्यसले usually के पनि affect गर्दैन pregnancy मा. Okay, it is a low risk pregnancy without any complications. At the same time, if the fibroids are big, ठुलो फाइब्रोइड छ भने चाहिँ एक त कन्सिभ गर्न पनि गाह्रो हुन्छ with big fibroids. अनि लोकेसन अफ फाइब्रोइड्स पनि हुन्छ. एउटा इनर लाइनिङ तिर त्यो फाइब्रोइड छ जसलाई हामीले सबम्युकोसल फाइब्रोइड्स भन्छौं. इफ द्याट्स द केस देन कहिलेकाहीँ कन्सेप्सन गाह्रो हुने, इभन कन्सिभ गरिसकेपछि पनि चान्स अफ मिसक्यारेज अलि बढी हुने, those risks are there. Okay. And कहिलेकाहीँ प्रेग्नेन्सी राम्रै भएछ भने पनि because of the big fibroids, during pregnancy अलि painful हुने pregnancy धेरै pain भएर कहिलेकाहीँ hospital admission हुनुपर्ने, chances of them going into preterm labor समयभन्दा अगाडि नै व्यथा सुरु हुन सक्ने, or normal delivery गराउनलाई गाह्रो हुने, if it is obstructing the pathway of the fetus, then chances of having cesarean delivery हुन सक्ने, during delivery also अलिकति bleeding normal लाई भन्दा अलि बढी bleeding हुन सक्ने, those possibilities are there. Yes.
Yeah. So thank you for bringing those concerns.
Yeah. Give me a charger.
So a lot of thank you. And actually we've received messages. Mapani, thank you. Because people who've asked the questions, their answers. So thanks.
Okay.
Everyone who's joined and who were commenting also. So we've received there's someone who's trying to conceive naturally at 41. What are some suggestions that you would suggest?
Yeah. So Sneha, I would want to switch my phone to another one. Hey, Malagi technical problem, but I had taken this phone. So give me a few seconds, all right?
Yes.
Okay. All right.
Sorry about that. I think Dr. Nira, so she's going to be joining again.
Yes.
Yeah.
All right.
Yes.
So can you repeat your question again?
I'll repeat. So it's someone who is 41 years old is trying to conceive naturally. So what are suggestions that you would suggest for someone trying to conceive at 41?
All right. So someone trying to conceive at 41, like request garchu bhane, she should consult one doctor, gynecologist, before even attempting to become pregnant, because as the age advances, the woman can have underlying conditions like diabetes, thyroid issues, blood pressure issues, heart disease, so all these things. So she should consult a doctor and find out if all her system organs are normal or not. Okay, underlying that needs to be treated first. Okay, number one. Number two, as you age, women fertility chances that becoming pregnant easily, it really declines with advancing age. Okay, so she should, again, with the same doctor whom she had gone for consultation, preconceptional checkup, the doctor will obviously check for her fertility, usko ovary ko reserve kati cha, ovarian reserve. What are her chances of becoming pregnant easily? Okay, so if her ovarian reserve is good and everything is normal, then she can plan pregnancy and hopefully she'll conceive spontaneously without any assistance also. But usually women who is above 40, usko fertility ko chances spontaneously conceive would have gone down in a normal situation. So in that condition, she would need some assistance to conceive. Okay, normal तरिकाले भएन भने nowadays you do this in vitro fertilization हरू पनि चाहिने, depending upon her ovarian reserve. She may be advised on all that. So त्यो भयो एउटा trying to conceive and possibility of conceiving. Okay, next thing is, once she conceives, she'll have to understand there are certain risks related in pregnancy with advancing maternal age, amako umer anusarle. So what are those risks? Again, even if she was fine before pregnancy, she can develop diabetes, she can develop thyroid issues, she can develop hypertension. All right, so these issues might just start be seen while she becomes pregnant. Okay, so she should be ready if such problem arises कि त्यसलाई treatment हामी गर्नुपर्ने हुन सक्छ, and what are the risks associated to the baby that is growing in her womb. त्यो एउटा भयो. र अर्को चाहिँ, with the advancing maternal age, पेटभित्र भएको बच्चामा पनि कहिलेकाहीँ few syndromes, I'm sure everybody is aware of a condition called Down syndrome. Down syndromeहरू हुने चान्सेस पनि आमाको उमेर बढ्दै गएपछि अलि बढ्न चाहिँ थाल्छ. So त्यसको लागि पनि what are the options, what are the testing needed, टेस्ट गरिसकेपछि रिजल्ट्सहरू के आउन सक्छ, के रिजल्ट आउँदा के गर्न सकिन्छ, all those possibilities and its management should be discussed beforehand. Yes.
Oh, thank you. I think the person जसले सोध्नु भएको उहाँले पनि त thank you भनेर मेसेज गरिराख्नु भएछ. So thank you. I answered. And so our question that I'm now moving to is a lot of people are asking, this is from a 36-week pregnant woman who's asking whether or not COVID shield vaccine linu huncha ki hudaina bhanera. So also a lot of men pregnant, they have that queries. Euta the pregnancy ma vaccine linu huncha ki hudaina, arko breastfeeding ko bela vaccine line huncha. So यसको बारेमा
yeah, एकदमै time appropriate question हैन. Few months agadisम्म पनि we were telling everyone, do not take vaccine, COVID vaccine, if you are planning to get pregnant, if you are pregnant, if you are breastfeeding. हामीले त किन भन्यौं भन्दा WHO को recommendation नै त्यही थियो, because the vaccine was very new, they did not know anything about it, how it would affect pregnant ladies and who are planning and who are breastfeeding. But with time, they have known कि safe नै छ भनेर. WHO recommendation has changed recently, and it says everybody, all the women, whoever are planning for pregnancy, who are pregnant or who are breastfeeding, kinaki they all can take vaccine, okay? And kinabhane they are more vulnerable group. Unarlai COVID infection hune chances pani body cha. Infection bhayihalyo bhane becoming sick, very sick, in ICU ko chances pani ekdamai body cha. These group of women should be prioritized for taking COVID vaccination. So अहिले पनि नेपालमा हाम्रो नयाँ नयाँ थुप्रो चाइनाले पनि दिएको छ, अमेरिकाले पनि Johnson & Johnson को दिएको छ. I think opportunityहरू आउँछ होला. So I would request everybody, all the women pregnant, planning or breastfeeding, go and take your vaccines. Yes.
Yeah, thank you. Yeah, I think there was a change in thought. Yeah, thank you for here everyone like vaccine, it's suggested, right? Yeah. So now I'm moving on to postpartum related questions, Aru, that I've grouped together from what we've received. So there's someone who hasn't been able to visit her doctor after having her baby. Her baby is 17 months. So should I be concerned, Vanira? So
yeah. So okay, normally after in the postpartum period, हामीले normally whoever have delivered like एउटा चाहिँ 1 week पछिको visit हुन्छ after delivery, अनि एउटा चाहिँ 6 weeks मा बेबी जन्मेको 45 दिनमा हामीले दुईटा schedule गरेको. त्यो दुवैको reasons छ. Okay, first week मा हामीले गर्ने reason चाहिँ अब if it was a normal delivery, usually तल perineum मा टाकाहरू लागेको हुन्छ, normally episiotomy दिएको कारणले गर्दा होस् या आफै tear भएको कारणले गर्दा होस्, usually generally many people have stitches over there, हैन. So त्यो घाउहरू कस्तो heal हुँदैछ, perineum कस्तो छ भनेर, प्लस एक किसिमको त्यो बेलामा ब्रेस्टफिडिङहरू कतिको गर्न सकिरहेछ छैन, उहाँको धेरै जसो बेला postpartum depression हुने पनि त्यही टाइम हुन्छ. So we would want to talk to them and see how they are feeling, केही assistance पो चाहिएको छ कि भनेर एक किसिमको एउटा 1 week को visit हुन्छ. All right, so that is recommended. अनि अर्को चाहिँ usually 6 weeks मा 45 दिनमा जुन बेला धेरै जसोको बेबीको पनि भ्याक्सिनेसनको टाइम हुन्छ, बच्चाको 45 दिनको भ्याक्सिन, सेम भिजिट मा उहाँहरुलाई हामीले बेबीलाई लिएर पिडियाट्रिशियनलाई भेट्नुस्, भ्याक्सिन सेन्टरमा जानुस्, and come to a gynecologist where we again examine उहाँको पाठेघर जुन normal pregnancy मा बढेको थियो, and there were so many changes that had happened, whether it has come back to normal or not, के इन्फेक्सन पो भएको छ कि, उहाँको जेनाइटल अर्गन्समा ब्लिडिङहरु पो भइरहेको छ कि भनेर एकचोटी हामी चेक गर्छौं. त्यो सँगसँगै नर्मली हामीले यही टाइममा यही मौका छोपेर एउटा प्याप्समेयर भनेर पाठेघरको मुखको पानीको एउटा स्क्रिनिङ, सर्भाइकल क्यान्सरको स्क्रिनिङ टेस्ट छ, त्यो पनि रुटिनली हामीले अफर गर्छौं हैन पोस्टपार्टम लेडिजहरुलाई. And at the same time we also discuss about contraception. किनकि धेरै जसो बेला pregnancy, postpartum, women are so busy with their baby and other issues that contraception नै उहाँहरूले बिर्सिनुहुन्छ अनि कहिलेकाहीँ they come with unwanted pregnancy when their baby is so small, they are pregnant again, and it causes a lot of stress to the whole family. So just to avoid all that, we talk to them about contraception during this visit. So it's a very, very important visit. हामीले उहाँलाई सजेस्ट चाहिँ गर्छौँ. In case कसैले कुनै कारणवश अब त कोभिडको कारणले गर्दा पनि people could not do their routine visits, हैन, ढिलै भए पनि one should go and meet their gynecologist and discuss all these matters that I just said. Yeah.
Hazur. Yeah, thank you. Yeah, I think postpartum care is equally important. Yeah. So it's definitely advisable to regularly go for the checkups or afno pani and baby ko pani vaccines or something.
Yeah.
So our question in postpartum is related to myth. So is it true that if we don't do oil massage after delivery that we will have back pain in the future? So हाम्रो यहाँ हुन्छ नि back pain एकदमै हुन्छ, oil massage हरू सुत्केरीलाई massage गर्ने एकदम important छ भनेर भन्छ. So त्यो back pain हुन्छ कि हुँदैन oil massage गरेन भने, and also stretch marks पनि will stretch marks go away or how can it go away भनेर पनि. So the duita questions are similar. So
okay, so oil massage हाम्रो सोसाइटीमा एकदमै गर्नुपर्ने चिज पहिलादेखि नै गरिरहेको, त्यसको धेरै बेनिफिट्सहरू छ, नो डाउट अबाउट इट. ओके, oil मसाजले पोस्टपार्टम पिरियडको जुन स्ट्रेसहरू हुन्छ, पोस्टपार्टम डिप्रेसन हुन्छ, त्यसलाई त हेल्प गर्छ. यु फिल लाइक यु आर टेकन केयर अफ, हैन, अनि आफ्नो जुन प्रेग्नेन्सीमा जोइन्ट्सहरू, आफ्नो मसल्सहरू जुन लुज भएको थियो, टोन नभएको थियो, त्यो सबैलाई all those oil तेल लगाएर मालिस गर्नेले धेरै बेनिफिट्सहरू चाहिँ छ डेफिनेटली. ओके, अनि त्यतिखेर इमिडिएटली बडीहरू जोइन्ट्सहरूको पेनलाई पनि त्यसले एकदमै बेनिफिट चाहिँ गर्छ. हाउएभर लङ टर्ममा गएर अहिले तेल मैले लगाइन भने पछि गएर मलाई ढाड दुख्छ, द्याट्स नट ट्रु. ओके, कसैले तेल लगाउन पाउनु भएको छैन कुनै कारणवश भने यु डोन्ट ह्याभ टु थिङ्क ला मलाई फ्युचरमा गएर ब्याक एक हुन्छ. इट्स नट लाइक द्याट. तपाईले आफ्नो बेबीलाई ब्रेस्ट फिड गरिरहनु भएको छ, एन्ड इफ यु आर टेकिङ क्याल्सियम सप्लिमेन्ट इनफ. ओके, किनकि धेरै जसो बेला पोस्टपार्टम पिरियडमा व्हेन यु आर फिडिङ योर बेबी क्याल्सियमको डिमान्ड एकदमै नै बढी हुन्छ र ड्यु टु सम रिजन इफ यु हेभन्ट बिन सप्लिमेन्टिङ योरसेल्फ विथ इनफ क्याल्सियम त्यसले गर्दा चाहिँ बरु ब्याक एकहरू हुन सक्ने लङ रनमा हुन सक्छ. इफ यु आर नट टेकिङ केयर अफ योर पोस्चर, हैन, प्रपर पोस्चर, वेट गेन एउटा चाहिँ पोस्टपार्टम पिरियडमा धेरै जसोले धेरै खाएर एकदम मोटाउनुहुन्छ, त्यसले गर्दा पनि ब्याकहरू आफ्नो यो भर्टिब्रल कलमहरूमा अलिकति प्रब्लम हुन्छ, त्यसले गर्दा पनि ब्याक एकहरू हुन सक्छ. So if you are taking enough calcium supplementation, if you are taking care of your weight, okay, and if you are attaining good posture, then I don't think so you should be worrying about backache even if you haven't taken oil massage. But if you have taken, that's good for you. Don't feel guilty. Yes.
Yeah, it's the Suruma, it's the time that after me time पनि जस्तो हुन्छ, आफ्नो self care early
गर्नुपर्छ. हाम्रो प्रेग्नेन्ट women, हैन, postpartum women deserve all that care.
Yeah, that care oil must be needed. So I'll alternate between हामीले अहिले यो live session मा पनि questions हरू आइराको छ, so I'll alternate between those questions also. So
there was another, I think, stretch marks.
हजुर, stretch marks को. Yeah, so once you
that also. So about stretch marks, something धेरै जसो women को आउँछ नै प्रेग्नेन्सीमा. Okay, अनि धेरैले सोध्नुहुन्छ, is there anything we can do during pregnancy to avoid stretch marks? There are so many commercial, creams and oils available nowadays who claims that यसले गर्दा stretch marks आउँदैन. Now different studies have shown that आफ्नो bodyको texture, आफ्नो skinको texture कस्तो छ, stretch mark आउने नआउने त्यसमा depend गर्छ, rather than applying those commercially available, the remedies. All right. So त्यो stretch mark क्रिमहरूले maybe to some extent it will reduce the incidence of stretch mark. तर आउनेको जे गर्दा पनि आउँछ, नआउनेको केही नलाउँदा पनि their skin is like एकदमै राम्रो, केही पनि stretch mark हुँदैन. Number one is that. Number two, can we do something to reduce the stretch mark जुन आएको छ त्यसलाई जानलाई के गर्न सकिन्छ त? So त्यसको लागि पनि different creams are available छ. Obviously with time, even if you don't apply, प्रेग्नेन्सीमा भएको रफ देखिने रातो डरलाग्दो देखिने स्ट्रेच मार्क्स विथ टाइम इट बिकम्स लाइटर एन्ड फेड्स अवे एकदम स्किनको कलरमा म्याच भएर जान थाल्छ धेरै प्रब्लम हुँदैन however if you want to do things quickly nowadays अलिक क्रिमहरू पनि अवेलेबल छ हामीले चाहिँ त्यसको लागि चाहिँ धेरै जसो बेला डर्माटोलोजिस्टहरूलाई पनि रेफर गरिदिन्छौँ उहाँहरूसँग यसको थुप्रै सल्युसन्स छ यु क्यान टेक हेल्प फ्रम देम कहिलेकाहीँ एकदमै कोही चाहिँ अब फेसन इन्डस्ट्रीहरूमा छ जसलाई चाहिँ एकदमै पेटको स्ट्रेच मार्क्सले उहाँहरूको प्रोफेसनमा पनि गाह्रो गर्छ आई थिङ्क दे अफर सर्जन सर्जिकल ट्रिटमेन्ट अल्सो फर द्याट त्योहरू पनि छ तर माइल्ड स्ट्रेच मार्क्स आफै पनि लाइट भएर जान्छ र युजुअली इट्स इन लाइक बिलो अम्बलिकस सो धेरै रिभिलिङ लुगा नलगाउनेहरू हो भने त्यो कभर्ड पनि हुन्छ सो धेरै जसोलाई इट्स नट अ बिग इस्यु एक्चुअली या
So thank you, Dr. Nira. So we're slightly over halfway, Amru. You Insta live session ko, and a lot of people have just joined. So I'll just quickly reintroduce Dr. Nira Pani and quickly mention. So Yoma is a knowledge hub for pregnant women, new moms, as well as experienced parents. And we have articles from experts, like Dr. Nira was one of the first few experts, Amru, while the article lekhera hamle support garnu bhayo थियो. And we also have moms who have different experiences, जसले चाहिँ आफ्नो experiences, some are anonymous, some ले चाहिँ नामलाई राख्नु भएको छ, and who have contributed their stories because we want to share the real, raw, the unglorified stories of motherhood as well. अनि हाम्रो लिस्टहरू पनि छ कहाँ के पाउँछ भनेर, not just what is important for a new mom, for a pregnant mom, but also where you get it भनेर पनि हाम्रो लिस्टहरू पनि धेरैवटा छ. So just reintroducing Dr. Nira because we have a lot of 40 plus followers view गरिराख्नु भएछ हैन. So Dr. Nira is head of department of Obstetrics and Gynaecology at Nepal Mediciti Hospital. She's also a laparoscopic surgeon and has received special training in Advanced Laparoscopy. So that's just a quick reintroduction for the new viewers. So अर्को एउटा question that we received live मा चाहिँ अहिले because we received mathematical कतिवटा थियो, so I'll quickly get into those. So for how many months do we use Folvin? अनि Folvin लाई 3 months लिइसकेपछि पनि if we are not able to conceive, should we continue it or not, or कति लामोसम्म Folvin continue गर्न मिल्छ भनेर?
All right. So Folvin is one एउटा कम्पनीको ब्रान्ड नेम हो. हामीले फलिक एसिडको लागि नै भन्छौँ हैन. र नर्मली हाम्रो नेपाल पाउने फलिक एसिडहरू 5 mg को स्ट्रेन्थमा पाउँछ. However, nowadays we get a good prenatal vitamins जसमा चाहिँ धेरै कम्बिनेसन प्रेग्नेन्सीको लागि, हेल्दी प्रेग्नेन्सीको लागि चाहिने सबै कम्बिनेसन अफ मेडिसिन्सहरू हुन्छ. Alright. So even talking about folic acid, हामीले प्रेग्नेन्सी प्लान गर्नु 2-3 महिना अगाडिबाट खान थाल्नुस् and try for pregnancy. Okay. So कसैको ट्राई गरेको 1 महिना 2 महिना 3 महिना 4 महिना भित्र कन्सिभ भइ नै हाल्छ. ओके. कहिलेकाहीँ if it's taking longer like 6 महिना भयो if you haven't conceived, यो folic acid त कन्टिन्यू नै गर्ने. र folic acid is not something which will help you conceive. It will just make your system ready for healthy pregnancy. All right. धेरै जसोले के भन्नुहुन्छ folic acid खाएपछि प्रेग्नेन्ट हुन्छ. It's nothing like that. Folic acid चाहिँ fertility enhancer medicine definitely होइन. यसले चाहिँ आफ्नो सिस्टमलाई अलि हेल्दी राख्छ so that when you conceive your baby लाई जुन एक किसिमको neural tube defects भन्ने एउटा abnormality बच्चामा आउन सक्छ if your system is deficient of folic acid. त्यही भएर folic acid को level चाहिँ मिलाएर राखौं when you're planning for pregnancy भनिन्छ. So even if you haven't conceived and still trying to conceive 3, 4, 5, 6 महिना कहिलेसम्म until you meet your doctor to find out why you are not conceiving, you should continue folic acid. र अब डक्टरलाई भेटिसकेपछि उहाँको सल्लाह अनुसारले you may have to continue it for longer. And once you conceive also, first 3 months मा चाहिँ हामीले folic acid नटुटाउनु खाइ नै राख्नुस् भन्छौं. र in fact small amount of folic acid त throughout the pregnancy नै चाहिन्छ. So little higher dose हामीले पहिलो 3 महिनामा खान दिन्छौं र lower dose मा either in the form of multivitamin or when we start iron, त्यसमा पनि थोरै folic acid already हुन्छ. So त्यो lower level of folic acid त throughout the pregnancy नै चाहिने हुन्छ. Yes. So folic acid खाइराख्दा आफ्नो पनि बडीको स्किनलाई, हेयरलाई र अरु सिस्टमहरुमा सबै ठाउँमा folic acid चाहिने नै हो. So continue गर्दा there is no harm and one should continue it till they find a proper solution to why they are not conceiving. Yeah.
Yeah, thank you. I guess sometimes people are, they're taking medicines and they're not sure कतिलाई लिन हुन्छ हुँदैन भनेर. So I'll move on to the next question, Dr. Nia, because we have a lot of questions and very limited time, only 20 more minutes. So another question is, if someone has frozen eggs at a younger age and has plans on conceiving post 40 years, do they have similar age-related risk?
Yeah, so very good question, very intelligent question. अब यहाँनिर के हुन्छ, मैले अघि पनि एज रिलेटेड कुरा गर्दा I talked about the two aspects of it. एउटा चाहिँ pregnant women may suffer some conditions herself, अनि अर्को चाहिँ the baby which is growing in her womb may have some issue. There were two issues, okay? So younger age ma egg frozen gareko cha bhane, what happens here is the egg that was frozen is very young, it's a healthy egg. So हामीले अघि जुन डाउन सिन्ड्रोमको प्रब्लमहरु बच्चामा आउन सक्छन् भन्यो, त्यसको रिस्क चाहिँ बढेन. However, the mother who is already above 40, उसको सिस्टमहरु त ओल्डै छ. So she may suffer from hypertension, diabetes, thyroid and other issues, like I said, but her fetus young हुँदाखेरि जति risk थियो, if suppose she froze her egg when she was 25 मा हुँदा त्यो बेलामा कन्सिभ गर्दा फिटसलाई के रिस्क थियो या थिएन, त्यो बेनिफिट्स यो उमेरमा पनि उले पाउँछ. So who will benefit from frozen egg is the baby, the fetus जुन चाहिँ ग्रो गरिरहेको छ वुममा, त्यसले गर्दा हेल्दी यङ एग नै हुन्छ. So त्यो advantage all the advantage will go to the growing fetus. Yes.
Okay, that's good to know. So the baby, like saying will advance risks.
So mom will have her. Yeah.
Okay. So thank you, Dr. Nira. So our question, I'll move on. Should there be a minimum gap to breastfeed after taking the COVID shot? COVID ko agi हाम्रो भ्याक्सिनहरुको कुरा गरिरहेको बेला आएको क्वेशन थियो यो चाहिँ.
तुरुन्तै खुवाउन मिल्छ. There is no gap.
Okay, sorry. अलिकति ब्रेक भयो छ तपाईको भोइस, अब फेरि ठीक छ.
So gap गर्नु पर्छ. I repeat my answer.
Yeah. Okay. Thank you. Yeah, and we've received a lot of mass messages. Thank you, Banner, because I think our viewers they're getting their questions well answered. So thank you, Dr. Nira. So our question is, after how many days of delivery should we use the postpartum belt? Is there any particular specific belt, or what belt would you recommend?
Well, त्यस्तो particular 80 day पछि मात्रै belt use गर्ने त्यस्तो हुँदैन. As soon as like you are post delivered, even if you have had your delivery by C-section, some abdominal binder, abdominal support एकदमै नै helpful हुन्छ, especially त्यो back ache हरुलाई relief गर्नलाई पनि एकदमै help हुन्छ. र हाम्रो age old tradition पटुका बाँध्ने has its own advantages, okay? So त्यसैलाई अहिले आएर अलिकति fancy way मा you get different postpartum belts. So जुन चाहिँ आफुलाई सजिलो छ, I wouldn't recommend any particular brand. Okay, हाम्रो age old पटुकै बाँध्दा पनि हुन्छ, soft खालको कपडा मलमल को एक किसिमको soothing effect पनि हुन्छ. You can use that also. But there are different commercially available postpartum belts. कुनै पनि आफुलाई यसो लगाएर हेर्ने, त्यसको material मन पर्छ, feel मन पर्छ भने you can use it.
Okay, yes. So as long as it's comfortable for you, so postpartum 80 days पछि मात्रै लाउने भन्ने छैन.
You can use it, yes.
Okay. Thank you, Dr. Nira. So अर्को is अघि हाम्रो skin care गर्दाखेरि, I think as we were talking, then related questions पनि आइरहेको थियो, but because we couldn't answer it right away. अर्को question that just came early was, can you tell more about hyperpigmentation during pregnancy?
Hyperpigmentation is a big issue during pregnancy, eh? Because of the hormonal change, again everything in body ma यति धेरै hormonal changes हरु भइरहेको हुन्छ, hyperpigmentation tendency एकदमै बढेर जान्छ. Okay, the main organs where it is affected, hyperpigmentation is area around your nipple, areola एकदमै dark कालो भएर जान्छ, and your belly, body राखेको belly मा you get this एउटा लामो कालो line पनि बनेर आउँछ, त्यो पनि कालो जस्तो भएर जान्छ. Your axillary area, your neck area, okay? Sorry for that.
पानी वाली.
Oh, I think I need some water.
Yeah.
All right. Give me a second.
Yeah.
Get some water. Thank you. Thank you. Yeah, I'm fine. So, त्यो भयो अनि आफ्नो जेनाइजल प्युबिक एरियाहरू पनि कस्तो कालो थाइको एरियाहरू कालो भएर जान्छ यतिसम्म हुँदा पनि usually many have no issues but when it starts your hyperpigmentation in your face then usually they have problem र फेसमा पनि कति बेला प्रब्लम भइरा हुन्छ प्रेग्नेन्सी मास्क पनि भनिन्छ कालो खालको फेसमा it is okay so that is something you cannot avoid it will come now त्यसलाई फ्रिज गर्नलाई के गर्न सकिन्छ त भन्दा especially face को चाहिँ avoid going into direct sunlight use a very good of skin moisturizer and sunblock त्यति गर्दा हुन्छ र usually these skin changes pigmentations are reversible भनेको after the pregnancy is over slowly you'll get back your color it's not like it's going to be there permanently okay
yeah
yes
okay thank you Dr. Nira. So I'll go back to a few questions that we received early on. So we have quite a few. We have around 8-9 of them at least that we have yet to answer. So so an ideal gap between first and second C-section, and also C-section done in a gap of 2.5 years. Would that be risky? Is one of the questions.
Wi-Fi. Yeah. So one C-section पछि अर्को C-section कहिले plan normally conventionally we tell 2 वर्षको gap गर्नु that applies even for normal delivery okay एउटा बच्चा सानै हुन्छ एउटा बच्चाले full care पाउनु पर्यो आमाको breastfeeding देखि लिएर अरु attention आमाको body पनि heal हुनलाई mentally physically at least 2 years को gap is a good gap okay and the same thing applies for cesarean also even if it was a normal delivery or a cesarean delivery have gap of 2 years all right so त्यो चाहिँ healthy gap हो however कसैलाई due to many reasons they would want to conceive quickly second pregnancy पनि बनाइहाल्ने all right so cesarean section पछि minimum कति gap गर्दा ठीक हुन्छ भन्ने हामीलाई धेरै question आउँछ okay so they say minimum एउटा cesarean भएको र अर्को cesarean को बीचमा 18 months को gap is good enough भन्नाले if your baby is 9 months old if you plan for baby conceive अर्को बच्चा 9 महिना so 18 महिना दुईटा cesarean को बीच 18 months gap is good enough okay त्यो चाहिँ हतार हुनेहरुलाई I'm not recommending छिटो pregnant हो भनेर कसैलाई छिटो नै हतार नै छ भने that is also good enough okay I've come across cases where कसैले by mistake they didn't plan but because they didn't use contraception बच्चा भर्खर 6 महिनाको भएको छ in fact recently I had a case where बच्चा भर्खर 5 महिनाको छ and she conceived now it is although unplanned they would want to keep the baby all right so obviously we would ask them to continue pregnancy अलि close monitoring गर्ने आमाको बच्चाको and usually these pregnancy are uneventful खासै problem हुँदैन if you are under a good supervision all right so this guilty feel गर्नु पर्दैन त्यसलाई abortion नै गरिहाल्नु पर्दैन you can continue your pregnancy safely under a good supervision किनकि कति जनाले चाहिँ भयो भनेर कोही डाक्टरले abortion गर यो त तिम्रो पाठे घर फुट्छ भनेर अत्याइदिएको डराएको केसेसहरु पनि we come across recently yes recently मैले एउटा डेलिभरी गरे बच्चा भर्खरै 14 महिनाको छ and she just delivered a second baby भनेको 5 महिनाको मात्रै थियो बच्चा when she conceived and cesarean राम्रै भयो केही issues थिएन so by saying that I'm not encouraging but by mistake भइहाल्यो भने you can still continue your pregnancy even if it is like 6 a little lesser than that however if it is planned and advisable say 2 years को gap nahi huncha
yes okay Okay, yes. Thank you. Thank you so much. Yeah. I've kind of lumped the C-section related questions together. I know. So C-section ko our question is, when can you resume exercise after C-section?
Yeah.
Or for
So
your
no exerciseहरू like walking, treadmill, अरू एरोबिक कार्डियोहरू 6 weeks पछि नै गर्न सकिन्छ.
6 weeks.
ओके,
Okay.
6
Yeah.
weeks यो डेलिभरीमा पनि अप्लाई हुन्छ. नर्मल डेलिभरीवालाले पनि 6 weeks पछि हामीले एक्सर्साइज सुरु गर्न भन्छौँ. But ab exercise where you want to reduce your tummy, so ab extension exercisesहरू चाहिँ 6 महिनापछि मात्रै गर्नु सिजेरियनमा भन्छौँ. किनकि भित्र सिजेरियनको घाउहरू अलि विक छ र त्यो बेलामै हामीले एक्सटेन्सिभ भिगरस एब एक्सर्साइजेसहरू गऱ्यौँ भने कहिलेकाहीँ त्यो घाउ राम्रोसँग निको भएको छैन भने यु क्यान ह्याभ हर्निया, एक किसिमको इन्सिजनल हर्निया भन्छ. त्यो भित्रबाट घाउ छुट्ने अनि त्यसले गर्दाखेरि अलिक कम्प्लिकेसन्सहरू आउन सक्छ. सो 6 महिना कुर्नु चाहिँ एडभाइजेबल हुन्छ फर एब एक्सर्साइजेस. नर्मल आफ्नो वेट रिड्युसिङ वाकिङ ट्रेडमिल यिनीहरू 6 weeks पछि नै गर्न सकिन्छ.
Okay, thank you. So I'll move into the next question. C-section related was 13 months postpartum. The wound is still very itchy above and below the wound as well. Right? So is this normal, and what can be done? Itchiness around the wound.
Yeah. So normally itchiness shouldn't be there 13-14 months भइसक्दाखेरि पनि एकचोटि चेकअप गरेर अब त्यो स्कार कहिलेकाहीँ केही इस्युज छ कि माइल्ड छेउछाउमा स्किनमा केही इन्फेक्सनहरू पो भएको छ कि भनेर एकचोटि चेकअप गराउनु चाहिँ बेटर हुन्छ. इट सुडन्ट इच अहिलेसम्म पनि. इट इज नट नर्मल.
हजुर.
Yes.
So thank you, doctor. So अर्को एउटा second baby related question is someone who's 32 years old and she has a 4-year-old boy अहिले हैन. So she's trying for another child and she had medically aborted due to some reason and now she started trying again. So it's been 4 months that she's been trying in the fertility window, but she's concerned about infertility early second. So she's asked, because she medically aborted, does that could that affect her second pregnancy? Because she's not getting pregnant.
Okay. So usually it doesn't. I think she's little guilty conscious also. Okay. So normally when you are trying 6 महिना त लाग्न सक्छ to conceive, isn't it? So I don't think so she should be worried much. अहिलेलाई नै. So she should be सबभन्दा पहिला guilt free. Past is past. She shouldn't सोचेर गिल्टी कन्सियस भइराखेर स्ट्रेस लियो भने कहिलेकाहीँ के हुन्छ, हाम्रो हर्मोनल सिस्टमहरू बडीमा कहिलेकाहीँ फ्लक्चुएट गर्छ, अलि इम्ब्यालेन्स भइदिन्छ, and that can cause some problem in conceiving. So she shouldn't be worried about that. Guilt free bhaera, stress free bhaera, she can try for a couple of more months. र कन्सिभ भएन भने एकचोटि कन्सल्ट गर्दा चाहिँ हुन्छ. कहिलेकाहीँ माइनर हर्मोनल इस्युजहरूले पनि इस्यु भइरहेको हुन्छ. So I don't think so she should be worried अहिले नै. Ask her to try for 2-3 months more. अनि भएन भने एकचोटि एउटा fertility workup गरेको राम्रो चाहिँ हुन्छ.
हजुर. Yeah. Thank you, doctor. So because we're short in time, I'm just moving on to the questions, right? So is it safe to carry your 13 kg toddler when you are in your second trimester?
All right. So मेरो Wi-Fi is causing problem. Yes. So 13 kg अलिकति धेरै वेट भयो. मैले धेरै जसो बेला के भन्ने गरेको छु आफ्नो क्लाइन्टहरुलाई भने बच्चा भुइँमा छ भने तलैबाट जुरुक्क उचालेर त्यसो गर्दाखेरि होल वेट बडीमा आउँछ, त्यसले गर्दा पेटमा पनि केही असर गर्न सक्छ. सो डोन्ट डु दैट. अब बेबीलाई काखमै लिनु छ भने उलाई बेडमा अरु कसैले राख्न लगाएर त्यसपछि सेम लेभलबाट अलिकति उठाउनु या कसैले काखमा राख्दियो भने एकछिनको लागि बोक्नु या आफू सिटिङ पोजिसनमा चेयरमा बसेर उलाई काखमा लिनु, यस्तो चीजहरु गरेर त्यो टडलरलाई पनि त माया त दिनु पर्यो नि आमाले. So you'll have to find a way where you are not hurting the baby inside your womb and at the same time you are taking care of your toddler also. So त्यसरी जुरुको बोक्नु चाहिँ it is not advisable. Yes.
Yeah, thank you. I remember having the same question when I was planning for my I was expecting my second baby and I had So अर्को question, yeah, thank you. I mean, we've received a lot of big questions तपाईँको session लाई. It's been super helpful and thank you भनेर धेरैजनाले मेसेजहरू गरिराख्नु भएछ. अनि एकजनाले चाहिँ यहाँ तपाईँको टाइमिङ्स र कन्सल्टेसन्सको बारे पनि सोधिराख्नु भएछ. What are your timings and where can we get consultation?
Yeah, so म चाहिँ Mediciti Hospital मा I'm available, full-time consultant there. And I'm available from 10 o'clock till 3 o'clock every day except for Saturday. Yeah.
Okay. Appointment line, they'll have to call Mediciti for appointments.
Yes. Yes.
Yeah. Okay. So our question is, should we visit the gynecologist as soon as we get test positive in the kit, or wait for a few more weeks so that once the fetus is more easily visible in the ultrasound? So kaile gynecologist
Yeah, so this is a good question. Hey? What we advise is pregnant hunu bhanda agadi नै एकचोटी visit your gynecologist. So you should always have a pre-pregnancy checkup. Okay? र त्यो गर्नु भएको छैन या गर्नु भएको भए पनि as soon as you know you are pregnant एकचोटी चाहिँ visit गरिहाल्नु. डक्टरले पनि हेरेर अल्ट्रासाउन्ड अलि पछि गराउन सक्नुहुन्छ. If history suggests छ कि तुरुन्तै अल्ट्रासाउन्ड गरेर हेर्नु पर्ने, maybe तुरुन्तै पनि गरेर हेर्नु पर्ने हुन सक्छ. But do not delay your visit. As soon as you know you are pregnant, visit your doctor. किन त्यसको थुप्रो एडभान्टेजेसहरु हुन्छ. So many tests will be done. र केही इश्यूज रहेछ भने तुरुन्त त्यसलाई करेक्ट गर्न पनि सकिन्छ. जबकि if you arrive late, then maybe it's already late for certain conditions to be like diagnosed and treated. So you should visit your doctor as soon as you know you are pregnant.
Yeah. Thank you, Dr. Nira. And also related to this is your Arkutaka question is about prenatal vitamins. So for someone who's planning to conceive, what prenatal vitamins should they take? And are they available in the Nepalese market? And they've mentioned iron, folic acid, magnesium, sabai included bhayeko. Which ones would you recommend?
So nowadays we do get this prenatal DHA gummies bhanera hamro yahako market ma Nepali. I think it's available online. Some of the online ma pani bhetirako cha, and few hospitals also have it. So it is a nice gummy orange flavor, which has all the ingredients needed for a healthy pregnancy, along with DHA, that is omega. त्यो पाइराखेको छ नेपालमै पनि. त्यो लिन सकिन्छ, has everything in it except for iron and calcium, which हामीले extra additionally पनि add गर्दिन्छौं. कसैको आजकल धेरै जसोको आफ्नो रिलेटिभ्सहरु बाहिर पनि हुनुहुन्छ, त्यहाँबाट पनि कतिले मगाउनु हुन्छ if they have access to it. त्यो पनि हामीले गर्ने गरेको छौं. र कसैले चाहिँ मलाई के गर्नु भयो भने भन्नुभयो भने Amazonहरुबाट they order it from here online and यही ल्याइदिदो रहेछ some of the agenciesहरुले. That is also available. एउटा possibilities चाहिँ रहेछ. Yes.
So thank you, Dr. Nira. So we have 3 more minutes. We still have quite a few questions that we haven't answered, that we won't have time for, because Insta Live, if it goes beyond 1 hour, then we cannot, post it on our Instagram. So I'll answer, and for the remaining questions which we will not be able to get to, we will make sure we reply to you individually.
So you can send me all those questions and I'll answer them. Yeah.
Yeah, and then we can also put it on our Instagram stories. Around 10 questions which haven't been answered. So we can take one last question. So I'll answer. I'll ask the last one. So there's someone who's been trying to conceive for 2 years, and so they're concerned about infertility. And what would you suggest, Vanita? 2 years on and off trying to conceive. So
2 years try गर्दा पनि conceive नहुने हो भने चाहिँ एकचोटी fertility workup, all the investigations, husband wife दुवै जनालाई एकचोटी गरेर के प्रब्लम छ, किन भइरहेको छैन, एकचोटी वर्कअप चाहिँ गर्नै पर्छ. And depending upon the reason why they are not conceiving, त्यही अनुसारले ट्रिटमेन्ट चाहिँ हामीले गर्नुपर्छ. I think 2 years भइसक्या भए अब डिले नगरिकन they should consult a fertility specialist. Yes.
Okay. Yeah. Yeah, so अर्को question, because we have time. So is it common for pubic pain and lower belly pain? So this was one of the first few questions हामीले अघि answer गरेको, but I guess this is from someone who just joined. अहिले live मा आएको question हो. So pubic pain को बारे फेरि एकचोटि, I think a lot of people have that question.
So हाम्रो lower part of body मा pubic pain, joint pain, hip joint हरूतिर यो pain are pretty common during pregnancy. There are so many hormonal changes that's happening in your body, and your body is getting ready for your baby to be born. त्यसले गर्दा त्यो बाटोहरु पनि ठुलो बनाउनलाई नेचरले नै त्यसलाई ठुलो ठुलो बनाउनलाई सबै रिल्याक्स गरिदिएको हुन्छ, राइट? सो त्यसले गर्दा अलिअलि पेन हुनु नेचुरल नै हो. हाउएभर त्यसले गर्दा धेरै नै डिस्कम्फर्ट भएको छ भने we teach them some exercises, prenatal exercises, जसले गर्दा त्यो joint painहरुलाई अलिकति रिलिभ चाहिँ हुन्छ. They can use all those tummy supports, belts, pregnancy supports पाइन्छ, त्योहरु युज गर्दा पनि हुन्छ. ओके, अलिअलि कहिलेकाहीँ मसाजहरुले पनि हेल्प गर्छ. राइट पोस्चर, right kind of diet, adequate calcium supplementation, all these things are helpful in relieving those pain. कहिलेकाहीँ completely 100% निको नहुन सक्छ त्यो पेनहरु, but they'll have to adjust to those pains, and सकेसम्म कम कसरी हुन्छ, they'll have to find a way out. Yes.
Okay. Thank you so much, Dr. Nira. So we're at the end of our Insta Live session. Right? The remaining questions, I'm so sorry that we could not address all of those. But yeah, I will send all those questions to Dr. Nira. And for the unanswered questions, we'll get you individual typed replies from Dr. Nira. Any message I will send it. And for those live, we will personally send you the messages. And we'll put it on our Insta story. Available, the knowledge is there for everybody. So thank you so much, Dr. Nira. Really helpful. I think a lot of people benefited from it. We've got wonderful comments. Thank you so much.
Thank you. Thank you, Sneha.
Thank you, Dr. Nira.